Awesome. Now, for someone who's watching, who's like, Doc, I agree. There are things to do. IVF, different things. Are there things I can do naturally to enhance the chances of me getting pregnant? What would you say to that?
Definitely. Definitely. So always when I'm talking to patients about the treatment approach, I'm talking about a three-pronged or three-armed approach. So we talk about lifestyle, and that's the focus I'm gonna have today. We talk about supplements, which I'm also gonna mention. And then third would be the fertility treatment piece. So what you do at home is actually just as important as what we're doing in the clinic. So things that we want to look at in a couple who is actively trying to get pregnant is, number one, from a lifestyle standpoint, how is our nutrition? How is our exercise? How is our sleep? Because we know that sleep is one of the pillars of health. We know that especially now post-pandemic, we're seeing more and more sleep disorders. Right. Number four, are there any work exposures? So there's actually some literature on firefighters, on long distance truck drivers, on hair salon workers, on a hair salon all day. So are there any work exposures that could potentially be risk factors for infertility? And you really want to focus on all of those things. And then the last piece I always like to talk about is stress management. We know that when a couple begins trying to conceive, it becomes very stressful, right? It becomes very mechanical, medicalized. And so we really want to make sure that the couple is proactive about how they're managing that stress, whether it's with meditation, yoga, counseling, online or group support. So there's many different ways of what that looks like, but it is important. The next thing I'll say is, do you feel optimized in your health? So are you at your optimal weight? Are your medical diseases, let's say somebody has thyroid disease, or let's say, we mentioned diabetes earlier, if they have an autoimmune disease like lupus, are all of these things optimized and well controlled? And if you're on medication, are those medications safe for you to be taking when you get pregnant? Or are those medications you should change and adjust and become stable on the new medication before you try to get pregnant? What I always tell patients is you don't want to be changing medications once you're already pregnant. So if you are, let's say you have high blood pressure and you are on a medication, you want to make sure that that medication is safe to take while pregnant, and you want to switch that now if you're not. Okay, so medical diseases, medications, optimal weight, etc. That's from a lifestyle standpoint. From a supplement standpoint, most OBGYNs and fertility specialists will agree that we want to make sure the patient is taking a prenatal vitamin with at least 400 micrograms of folic acid, which is contained in most over-the-counter prenatal vitamins. And you want to make sure you're actually taking that before you start trying to conceive, because ideally those folic acid stores would be replenished at least 1 month before conception. In the last 5 years, we also see a lot of literature coming out on vitamin D. D as in David. And the fact that it may be implicated not only in our general well-being and general health, but also in reproductive health. And so that's really important, that if your primary isn't checking it, or that you're supplementing with it, to make sure your vitamin D levels are appropriate. Every other supplement is really going to be tailored to the patient's individual case. So for example, if a patient is not ovulating regularly, they have a disease, for example, known as PCOS, there may be a supplement called inositol that is recommended. If a patient has a low egg reserve, they may be recommended to take something like CoQ10 or DHEA. So there's a few other supplements that are out there that you may read about, but they really should be tailored to the patient's individual case. So outside of prenatal vitamin, folic acid, vitamin D, there's really nothing that I would sort of recommend blanket across the board for everybody. And then the third thing that I talk about is monitoring ovulation. So if you are having regular monthly cycles, which hopefully you should be, if not, you should be talking to your doctor. And so you should look back and be able to say, okay, I have regular 28-day cycles, 30-day cycles. And we know that ovulation is occurring approximately 2 weeks before the onset of menses. So if you have 28-day cycle, so 2 weeks before that is going to be cycle day 14. If you have a 30-day cycle or 35-day cycle, you're going to be ovulating later in the month. And the reason that this is important is because when you're checking for ovulation, and we're going to get to that in a second, you don't want to be discouraged. So you want to know the cycle length so that you can know when to check for ovulation.
Right.
As far as checking for ovulation, I do recommend ovulation predictor kits. These are basically urine strips. You check your urine once a day. They're found in any feminine hygiene aisle in any pharmacy or big box store. And essentially, you would start checking a couple days before ovulation. Once you get a positive, the recommendation is to have intercourse the day of the positive and the day after. So for example, kind of the classic textbook example, 28-day cycle, we expect ovulation around day 14. The patient may start testing around day 10 to 12. They'll get a positive around day 14. They have intercourse day 14 and 15. This serves two purposes. One, obviously, is to optimize the likelihood of pregnancy, because we know that we want to try and catch, the egg in its optimal timing with the sperm. But secondly, I think it also serves a really important purpose in the relationship, because when a couple is trying to conceive, if you tell somebody to have intercourse every other day for 3 weeks, or if you tell them to have intercourse, every day around the time of ovulation for 10 days, it can become very automatic. It can really strip away any intimacy for the couple. And so allowing them to identify, okay, this is when I'm ovulating, this is when intercourse is happening, allows for the rest of the month to really be dedicated to intimacy and reconnecting with your partner.
I like it.
Sorry, I went a little long there. I apologize.
No. Very, very helpful information. I love that you